We are tracking an Ebola outbreak ripping through Central Africa, and this as health officials here at home are working to stop the spread before it gets to the U.S. It is now the third largest outbreak of this virus, starting in the Congo, where suspected cases have now passed 1,000. Hundreds are dead. It has crossed the border into Uganda. The WHO warning that this outbreak could be significantly larger in scope than the numbers even reflect because this virus went undetected for so long. We're also dealing with a rare strain of Ebola called Bundibugyo with no current vaccine to treat it. According to the CDC, America is Ebola-free right now, but to keep it that way, the U.S. had arranged to have Americans exposed to the virus quarantined in Kenya instead of coming back home. They were to be housed in a 50-bed isolation unit at a local Air Force base, but Kenya's High Court has rejected that plan now, barring anyone from entering Kenya who's infected or who was exposed to the virus, citing an imminent threat to life. New York's JFK is the busiest airport for international arrivals. It has now become the fourth hub to screen all travelers who've been to the Congo, Uganda, or South Sudan. Ebola screening was already underway at major airports in Washington, Houston, and Atlanta. The problem is screenings may not catch everyone who is infected with the virus, as symptoms typically don't show up for about 10 days after exposure and sometimes longer. For more, we are joined by Dr. Anahita Dua tonight, a vascular surgeon as well as founder and chair of Healthcare for Action. Dr. Dua, always good to have you on. These Ebola numbers seem really concerning. Can you tell us about this Bundibugyo strain and what is making this outbreak so pernicious?
Of course. So unfortunately, Ebola is not something new that we've been talking about on the news. There have been multiple outbreaks as recently as just a few years ago. But what makes this strain especially concerning is the number of people that have been infected and the fact that it has, in fact, already crossed the border. The good news is that in the United States, we have a lot of layers of protection, starting with the CDC and kind of the approach in the airports, as you mentioned, all the way through to the way that we quarantine. So we really know what to do in this particular type of situation. So at this point, as has already been said, we are Ebola-free and safe.
Former CDC Director Robert Redfield spoke to News Nation earlier this week. He is downplaying any risk of Ebola spreading here in the U.S. Let's take a listen to what he had to say.
It's possible we'll have a sporadic case here and there. We had Ford in the 2014 epidemic, but this is not going to be a major threat to the United States. It's going to be inconvenient for international travelers.
Do you agree with that assessment? Is the U.S. clearly safe from Ebola spreading here?
I wouldn't say it's clearly safe. We have to keep caution in front of us. But I will make the point that Ebola is different than measles or COVID in how it is spread. So what he means is basically for someone to get the disease, you have to come in contact with actual body fluids or a dead body of somebody who has Ebola, which is difficult. So let's say that someone were to come here and even have the disease, it would be something that would be fairly contained relatively fast. It wouldn't just spread like wildfire the way that measles or COVID could do, because those are airborne pathogens.
Is this Ebola outbreak in Africa worse as a result of any recent U.S. actions pulling back from participating in global public health efforts?
Well, the biggest thing is that we're not part of the WHO in the way that we used to be. And the WHO acts as almost a library where it keeps all the information about the type of outbreaks. And then we have, of course, very strategic access to it. Because we've had so much chaos recently in the administration, we really don't know who's there, who's monitoring, and as a result, who's protecting. So at this point, it's possible that because of some of these decisions, we may end up more in a firefighting situation. As I mentioned earlier to you as well, the CDC has for years been excellent about the way in which they approach outbreaks, how they're managing things at the airport, but we simply don't know with this administration who's doing what, if we have enough staff, if they're properly trained, if they've been fired and rehired. So it's hard to really say what those impacts are going to be on this particular virus.
With the time that we have, Dr. Dua, I do want to ask about a new study that says that GLP-1 drugs could lower the chance of cancer progression. This is one of many early studies that seems to be showing the drugs might have some anti-cancer effects. In 6 of 7 people who were tested with cancers, the medications were less likely to have other tumors spread. Why might that be?
Well, it's very exciting, I'll say, but it's important to start out by saying that this GLP-1 basically doesn't cure cancer. But what is happening is that when you take this drug, it does seem to have an impact in these basic studies, so again, not the major studies, on cancer progression, because obesity-related cancers seem to have a reduced impact on people because we're reducing their weight. So in other words, if you are obese and that causes chronic inflammation and that then causes breast cancer, colon cancer, liver cancer, by taking these drugs and reducing your weight, you may be decreasing that chronic inflammation and as a result decreasing the spread of the cancer or even decreasing the chances that you get it. So that's the pathophysiology that is surrounding this exciting new discovery.
Dr. Anahita Dua, always appreciate the time. Thank you so much.
Thank you.
Still to come.